Hi, this is Frank Barone at EVOLV Plastic Surgery Medical Aesthetics. I wanted to talk to everybody about our plan as we slowly open back up again and discuss some of the measures we've taken beforehand to prepare, the measures we'll be taking during and after to provide the maximal safety and confidence for our patients. I think in these uncertain times, there's been a lot of questions about when things are going to open, and going on what Governor DeWine has said, it'll be a gradual phased-in process. We have been open seeing medically necessary patients during this time and answering calls on a limited basis. During this time, we've been focusing on education for our staff, as well as doing many posts and other videos for patient education, because we want to use this time wisely. We've also been updating our manuals and organizing things and becoming more focused. So I want to just go over what our specific plan is for reopening. First of all, from the sanitation standpoint, we're going to be doing an industrial cleaning of the entire office this weekend before we open on Monday, stripping the linoleum floors and having new finish placed, and industrial cleaning of all the carpeted areas, wipe down of all the points of contact in the entire office, door handles, computers, everything. The other thing that's going to happen is we're going to leave the front door open and minimize any points of touch as much as possible. Pre-screening, we were going to give patients a call before their appointment to take a quick history and go through all the COVID questions to be sure it's safe to come in. If it's a new patient, we might call a week or two ahead of time to get all your information so we can be ready and have to minimize your time that you're in the office. One big advantage will be less waiting, of course, but we're going to have to space out more time in between visits. The waiting room will have some appropriate social distancing chairs available. But if you come in with someone, we're going to ask that they stay in the car during your appointment unless it's necessary to have a caregiver or someone with you. We will ask that when you do make an appointment that you call ahead of time, and after your appointment's been arranged, call when you're on your way so we know when to expect you. But when you arrive, you let us know. Then we'll have someone meet you at the front door to take your temperature and check to make sure we have all the pre-screening information available. As far as wearing masks, per Governor DeWine, we would agree that we would encourage everyone to wear a mask just as a precaution and a courtesy. All of our clinical staff, when in contact with patients or in the clinical area, will be wearing masks. So once you're taken into the office, we'll have you go to one room, and there will be minimal points of touch and contact. The staff will have masks on, as I mentioned, and gloves to do your examination and do any particular other, take information as we need it. If you're having a procedure done, we're going to limit those things appropriately and prioritize them as well. So we'll have more information to you as time goes on because these things are changing constantly. We will be prioritizing visits because we won't be able to handle as many people, at least for now, at the same time. So we will try to prioritize based on need. And also, if you're in a high-risk group, such as the elderly or someone such as our breast cancer patients who are taking chemotherapy, they have a lowered immune system. So we will have those patients seen at specific times to minimize exposure to any infectious agents. In the office, in addition, we also have commercial air purifiers, which have a UV light within them that is bacterial and virucidal. So that'll be present as well. If you're having a procedure done, we also have filters in the operating room if we're using anything such as a laser or cautery to minimize any exposure. The hours of service may be extended to accommodate the increased time it's going to take with everybody. If you inquire, we'll give you more specifics as we just base it on need. We'll also have a virtual type of lobby and telemedicine option. So for patients who feel more comfortable at least having their initial exam at home, or maybe it's a follow-up, we have a online service for doing a virtual consult. We also have our Touch MD app, which we have screens in the office, so you would be able to load your own pictures at home. We would tell you how to do that, and we can actually do a full exam in real time on Touch MD, where we can show you before and after pictures. We can analyze your pictures, discuss your goals. All of that would be available. And then when you do come in, it will save quite a bit of time and minimize points of contact. Again, all of this is based around safety and patient care. As far as retail goes, we won't be able to have walk-in shopping in retail, but if we know, or you can tell us what products you normally have or what you would like, we can have someone run them out to your car for you, or deliver them to you at the front window. We also have mail service available or online services. So if you just inquire, we'll find a way to get it to you that's most convenient, and again, with maximal safety. During this time, we won't be able to take any products back, of course. So we won't be able to offer a return policy for products purchased during this time, since we can't take anything that's been touched back in the office, which I hope everybody will understand. But that usually is very minimal, and we'll work with you on that. As far as surgery goes, we're starting a slow resumption of surgical services, again, based on need and prioritizing. We'll likely also be doing shorter cases at first, because we want to preserve the personal protective equipment as needed for the surgery center and the hospitals, and also try to conserve masks. We won't be able to provide masks to everybody, so we would ask, if you want to wear a mask, that you please bring your own or bring it from home, and we'll go through our protocol for safety with wearing masks when you arrive, or we can tell you on the phone. Surgical procedures, when we resume, we'll do that on a gradual basis, and we'll let you know how that will work. We would ask, if you're going to have surgery, that you be isolated to some extent before surgery, so you're not exposed to anything, or let us know if you were exposed, because we want to make sure that you don't have any risk or any increased risk when you're having a surgical procedure. So I'm sure other questions will come up over time, but I want to assure you that our focus has always been patient safety and patient care, along with education. And we want to provide an environment where you feel safe, where you feel you're getting the best care available. Our staff is very excited to see you back. And I think if we follow these policies, of course, they can change. We will be able to provide you with an experience that is safe and gives you the best outcomes. So I thank you for your patience and support. And if you have any further questions, feel free to call anyone at the office. We'll see you soon. Bye-bye.